You know, we all know there's a wide range of symptoms associated with COVID-19, but a recent viral post is calling attention to a surprising revelation. You got to check this out. COVID-19 has continued to surprise us all, not only by how it affects the body, but how it affects everyone differently. Various symptoms have been reported over the last year, from loss of taste and smell to lesions on the feet, also known as COVID toes. But one new mom has recently gone viral for yet another strange side effect: green breast milk. People on the internet were shocked, while others even came forward with the same problem. But how common is color-changing breast milk? Is it safe for the baby? And when is it an emergency? The doctors investigate. And joining us is the mom whose green breast milk went viral. Anna, welcome to the show.
Thank you. It's great to be here.
So first things first, you had COVID. How are you feeling now?
We're doing much better now. The only symptom that's left is I still can't smell anything.
Question, did your baby ever get it?
She actually got sick before I did, but she had a very mild case, just a slight fever and a little bit of cough. I actually think I got it from her.
So Anna, when did you notice the green breast milk?
So I normally breastfeed directly, and I only pump occasionally because I donate and I like to have a small stash saved up for emergencies. So probably around when I was most sick, like maybe a weekend, I decided to pump because I felt like my supply was a little low. And that was when I noticed the bright green milk that I ended up posting. I did have like lighter milk throughout the illness as I continued pumping and freezing it throughout that time. But the brightest green was like at the peak of my illness, like a weekend.
So did you call your doctor at that point?
I did. I called my doctor's pediatrician right away, and she asked if I had changed anything in my diet, which I hadn't, because I've heard that's a common reason that breast milk will change color. And she said not to worry about it. It's completely normal. It was most likely caused by antibodies from my daughter being sick and then myself being sick, and that it was perfectly safe to continue breastfeeding her as normal.
All right, well, to help shed more light on this, I'd like to bring in pediatrician Dr. Daphna Adut. Dr. Adut, a pleasure to have you back on the show. So what do you think is going on with the green breast milk that Anna's talking about?
Anna's pediatrician is definitely on the right track. When mom is sick with COVID or the flu, or even when baby is sick, mom starts producing antibodies and white blood cells. These are cells that fight infection, and both the antibodies and white blood cells are transferred from the breast milk to baby, and that causes the breast milk to change color. And so that's definitely right on the right track with that. And also, like what Anna was mentioning, when we're eating different foods like green vegetables or any drinks that have a green dye in it, that can also definitely change the breast milk to a green hue. And in cases of mastitis, so that's a breast infection, that can also change the breast milk to green. However, it's still encouraged and advised that mom continue breastfeeding through that as well.